Exercise, the way I describe it to people is you have to feel a little uncomfortable while you're doing the exercise.
Nice.
And there's different scales that people use, but if you put it in heart rate terms, you're looking at sort of 60 to 70% of what we would call maximal heart rate, which is an age-dependent thing with some genetics involved. But in simplest terms, it's, I'm dedicating myself that even if I'm walking brisk enough where it's a little uncomfortable for me. I know my heart rate's up. I may be sweating a little bit based on the time of year or what I'm doing. If you exercise at that level, there are lots and lots of things that happen in your body. There's hormones that get released, there's chemicals that get released that do a whole host of things that stabilize membranes, they act in the repair process. One of the reasons they think it may help cancer, right? We know a lot of cancer treatments now we use the immune system to target cancer, and so exercise actually helps boost the immune system. So that may be why exercise helps prevent some of these things. And so you're talking about very specifically almost every condition you can think about, exercise has a benefit. The only very few that I can think about, people with migraines that are actively having migraines, exercise is not generally helpful because it makes the migraine worse. But people with migraines that exercise on a regular basis tend to have less migraines. People with high blood pressure, obviously diabetes, mental health issues, depression, anxiety, all get better with those sort of things. I mean, again, sleep. I mean, that's an important one I tell people when they say, listen, I'm not sleeping well, and we know how important sleep is in terms of basically our overall health, cleansing the brain. That sleep gets better if you're getting exercise during the day.
One of the things I like to tell my patients is, if you want, they come in, they just don't feel good.
Yeah.
And they're like, Doc, I want to feel better. A lot of them are asking me for some kind of vitamin or energy pill or some type of remedy. And I'm like, I got a remedy for you. And that remedy is exercise. If there's one thing that I've noticed that exercise does for me is it just gives this perception of well-being boost. You go out and exercise, you're in a better mood, you perceive yourself to be healthier because you are healthier.
Yeah. I think that's a misnomer. I mean, I think we don't do a good job sometimes. I know I don't when I talk to people about exercise. Is really describing it. This is a therapeutic intervention for your health.
Right.
This isn't just me saying, hey, go exercise.
Go exercise.
That there are chemical things that happen to your body when we use appropriate therapeutic exercise. Now, sometimes in my world in orthopedics, sometimes that therapeutic exercise is like a strength training exercise because I'm having a problem with a certain body part and we need to actually get that body part. We're either working better or stronger. Or if we're just talking about, hey, somebody's got a little bit of high blood pressure, and like my case, I have a little bit of high cholesterol. I know that if I exercise at the right therapeutic level, that's better than me taking medicine for my cholesterol.
Well, that's great to hear. So let's talk about just the average individual who just wants to look better and to feel better. We were talking earlier about what motivates people to exercise. And what motivates people to exercise is probably what motivates them to do really anything, and that is that they want to look better and they want to feel better. I think the health outcome things we're more focused on those. So your average guy or gal that wants to go out and exercise, what do you recommend?
Well, I think a couple things to start. What I always tell people is, again, we want to get to the root, why we want to exercise, what's the point? And because you and I were talking a little bit earlier too, exercise is not great for large weight loss. Right. When it's by itself.
By itself.
Right. And
Without
any changes. And what I always tell people when we talked about this before too is that it's really hard to out-exercise bad eating habits. Right. Yeah. Now you could.
But I've been trying to do that my whole life.
Yeah,
come on now.
Me too. But you could, in theory, I think, exercise enough throughout the day, and there are certainly people that burn 10,000 calories a day.
If you're training for a triathlon or running a marathon. That kind of thing.